this question and answer session on dyslipidemia, basically triglyceride and cholesterol levels. So initially, the first question I would like to ask Dr. Jolly is, what is cholesterol? What is lipid profile?
Basically, when we check the blood test, we see lipid profile. That is the usual term we are using. So when you get the result, there will be total cholesterol and triglyceride and HDL, LDL and very low density lipoprotein, and then some ratios also, HDL, LDL ratio and something like that. So lipid means it is the fat part of the, it's a fat actually. When this cholesterol is a part of lipid, it's a fatty thing. Triglyceride is the usual oil. We use the cooking oil, coconut oil, sunflower oil and all. That is actually triglyceride. Triglyceride means one glycerin atom and 3 glyceride actually, and 3 fatty acids are connected. So that is the form of any oil. And even this animal fat also is of this triglyceride format. In the animal fat, there will be cholesterol also. This cholesterol is a part of the animal cells actually. The plant doesn't have any cholesterol, but the animal cell integrity is cell wall. The integrity is actually, the cholesterol is giving integrity to the cell wall of the animals. So when you take animal food, there will be some cholesterol also will be there. But in plant food, that is vegetarian, pure vegetarian food, there is no cholesterol is inside that. Then next is we have talked about cholesterol and triglyceride. Next is HDL, LDL and VLDL. Actually, this HDL, the fat, this triglyceride and the cholesterol is not soluble in water. So when the body wants to circulate, see where this blood is giving it to each cell of the body, it is going and giving this cholesterol and triglyceride to wherever they want. So it cannot be dissolved in the water. So it is carrying on it. Say when those material, when you take it in a truck, just like that, it is made in a dissolvable form, soluble form, make it into a lipoprotein. Lipoprotein format, it is transported to different part of the body actually. That is called LDL, HDL and VLDL. HDL means the density is high. Actually, it is almost unloaded truck. There is not much cholesterol or triglyceride is there. But LDL is having more triglyceride, so it will be more big, and VLDL is even having more, and it's actually there is another much more bigger one that is called chylomicrons, that is actually coming from the intestine directly to the liver. So usually that won't be there in the general circulation when we take a blood sample and all. So that is when we absorb directly, so it is a bigger, more fat containing chylomicrons also are there. And that is the difference. But basically, we should understand that when you have more low LDL, there is more fat is there. And usually when the LDL level is high, the triglyceride level also will be high also. HDL is good. We call the HDL cholesterol good cholesterol because it is unloaded. No? So wherever there is excess cholesterol is there or triglyceride is there, it can take it and go back to the liver. Actually, it is all coming finally to the liver for processing it. So HDL is high means if anywhere there is cholesterol, it will bring back to the processing unit.
See, this lipid profile changes take place. That is, sometimes this cholesterol increases, triglyceride increase, and when medications are taken, sometimes the cholesterol goes down very fast. Triglycerides also go down, but not that fast. So, what are the reasons for these changes of increasing as well as how is it decreased using medicine?
See, the triglycerides and cholesterol is actually circulating inside the body. It is coming. The actual triglyceride is actually absorbed from the. When you take food, you are digesting it and taking into the. It is absorbed into the bloodstream. So this bloodstream, it is coming as the triglyceride. When you take carbohydrate, it is coming as digested as the glucose and taken into the liver. And when the triglyceride is taken into the liver, it will be used as a for the many process. It is processed and it will be, if it is excess, it will be carried into the adipose tissues. When the glucose is coming into the liver, it will be processed and excess. Initially, some amount will be stored as a carbohydrate itself as a glycogen. That is also inside, mainly the glycogen stored is inside the liver itself. And the extra glucose will be converted into again to triglyceride. That is also fat. And it will be carried out from the liver and deposited inside the adipose tissue. That is the fat cells. That is everywhere in the body, fat cells are there, under the skin, in between the intestine, covering all the organs like kidney and even the chest. Or every part, even inside the muscles, every part there is fat cells are there. It is stored as a stored energy actually. That is the purpose of this fat. When why this is increasing in the blood? When you take your food at high in cholesterol or high in triglyceride, vegetable fat or vegetable oil is high in triglyceride. When you eat that or even nuts you eat, the triglyceride level will increase. When you take animal fat, even egg yolk is very high in cholesterol. When you eat 1 or 2 eggs or 3 eggs and 3 egg omelette and all, immediately there will be an increase in the cholesterol. Because it is all fat and cholesterol is very easily digestible and it will be easily absorbed into the system. So it's mainly depends on what you eat actually. The cholesterol level, the triglyceride level, everything is connected to the what you eat also. But the cholesterol is not just absorbed from the intestine and all, but it can be made in the body also. If you are a vegetarian, there will not be any cholesterol inside your body is not getting any cholesterol from outside. Only your body is making it. So it is not cholesterol. It is not just connected to the what is you are eating. You know, it is how much your body is producing also. That is why when you take medicine for very effective medicine for controlling the cholesterol level is statin. Statin, what is doing? Statin is blocking the mechanism or metabolism of production of the cholesterol. So if you are taking 3 days statin and the 4th day if you check the blood cholesterol level, it will reduce definitely. And especially if you are a vegetarian, you are not taking any non-veg items, egg or fish or meat, it will be naturally to go down. But the triglyceride won't go down like that. If you take nuts and if you are taking a statin and all, but if you take enough nuts and rice and wheat and this carbohydrate or fatty things, you definitely triglyceride won't come down that fast.
This cholesterol, triglyceride, and cholesterol itself, HDL, LDL, LDL, and all that. How does these affect the health of the person? The cholesterol, because we say cholesterol is needed by the body. Then if there is excess or if there is lack of cholesterol, how does it affect the body?
See, cholesterol is an essential ingredient, raw material for the production of, say, we are producing vitamin D from sunlight. Because when the sunlight is falling on our skin, the raw material for the production of the vitamin D is cholesterol. And also the digestive juice, actually this liver is producing bile. That is actually stored in the gallbladder, gallbladder. And it is actually, when you eat food, it is also, it's a digestive, it has an important role in digestion. This bile salt, bile is, my main content is bile salt. Bile salt is made of actually cholesterol. So next is actually the importance of cholesterol is the steroid hormones. Steroid hormones is having a very important role in our immune system and our many metabolic activities. How steroid hormones are important. When you are very sick and or even with the COVID, when they are very sick, when they are using high doses steroids. So when the stress situation is there, the body needs steroids to combat with that. That hormone is made from the cholesterol. That is the raw material for the cholesterol is steroids is cholesterol. And the mineralocorticoid, that is actually this aldosterone hormone, that is also produced from this all mineralocorticoids, glucocorticoids, sex hormones. All these three groups are made in the adrenal gland, that is sitting above the kidney. There is a cap-like thing. That is actually the adrenal gland. It is making all these hormones, including the sex hormones. For the male, it is testosterone. Female, it is estrogen and progesterone. So this aldosterone for the electrolyte balance, and the glucocorticoids and steroids, and also the sex hormones. All this needs the testosterone. All this needs cholesterol for its making. So if the cholesterol is low, we won't be able to make these essential things. The body will not be able to produce, and the functioning will be reduced. And also another important role of the cholesterol is to give the integrity to the cells. Especially all the cells need cholesterol for that, and especially the brain activities also needs cholesterol, because brain is made of brain cells is made of mainly cholesterol and water. But the other muscle and other body parts, mainly protein is the major part, other than the fat tissue. So if the cholesterol is content is low, the building of the repair mechanism. See, when a cell is damaged, we need to replace the damaged cell with a new cell. For producing the new cell, this cholesterol is needed. So cholesterol is an essential part of our metabolism and body building and all. So if you block the cholesterol production, so you are blocking the metabolic process itself.
Actually, when we talk about this dyslipidemia, triglycerides, cholesterol, the first thing that comes to mind is overweight and obesity. Some people say that when they become overweight or obese, their cholesterol and triglycerides have risen. And some people feel that when cholesterol and triglycerides rise, the person can become obese. What is the actual situation?
Lipids and this triglyceride, cholesterol, HDL, we are measuring in the blood. This excess, when it is coming in the blood, it is excess. That means usually if it is produced in the liver, It is absorbed from the what we eat, the food is absorbed and brought it into the liver. And liver it is converted into excess glucose is converted into fat, or the triglyceride it is coming. It will be directly taken for the, if it is an energy need is there, it will be used as energy to make ATP, that is our energy currency. And the liver or all the, it will be given into the blood, and the cells will take it up and use it for the energy production. But if the excess is there, it will be taken to the storage place. Storage place is the fat, for the fat, the storage place is the fat cells. When the fat cells are filled with the fat or the triglyceride and cholesterol, or they won't take it up. So what can happen? It will be circulating inside the blood. So this LDL and VLDL and all is the fully loaded fat cholesterol or this transporting system. So no one wanted it. No cell is needing that. So it will be accumulating inside the blood. That is why the blood it is increasing. Then it will look for places where to deposit. So it will deposit inside our own blood vessels. That is called a atheroma. That is plaque center. We call it plaques. When we get a heart attack and when we say, or when we look into the heart, when you get a heart pain, you check the angiogram, and the doctor will say there's a block inside, a 40% block, 60% block, 90% block. These all are the deposits of fat inside your internal, inside of your blood vessels. So it will be blocking, making a block inside the blood vessels, and it will observe the free flow of blood will be, and also the mechanism of the blood lining, the arterial lining and all will be affected. So that also will release some inflammatory factors and all. Is again it will increase the making the chance for the blood pressure to go high. So that is the cholesterol and the triglyceride increase in the blood is directly connected to the BP going up also, because it is damaging the blood vessels. That is the reason why most of the hypertension patients, when we look into the blood, the triglyceride and cholesterol will be high, and they are already then if they are taking very high dose of statin and all, maybe it is okay. That's why most of the patients of diabetes and hypertension, they will be having loss of statin also. It is the usual thing what we are seeing.
Very common is the situation when people who have diabetes also have dyslipidemia, high triglyceride, high cholesterol. So it is said that diabetes can cause this situation also and can add to this problem. So in such a situation, how do medications help?
See, diabetes is actually excess glucose. Why there is excess glucose? When we take food and it is absorbed into our liver, and the liver is converted into if excess is there, it is distributed in the blood, and if it is excess, it should be converted into either triglyceride or glycogen. Glycogen, there is only 700 grams or up to 1 kg glycogen only is in our body. Actually, that carbohydrate store is only 1% of our body weight. So the excess carbohydrate will be stored as a fat inside our body. When if a patient is diabetic, that means the person is taking more carbohydrate, which is not needed for the process. His body or her body cannot process that much of carbohydrate. So if this glucose will be excess, and the poor liver is not able to convert it into fat, or if it is converted fat is not, the fat cells are not accepting it as storage because they are full. So what happens initially in diabetic patient, the glucose is increasing. Then next stage, the fat level started increasing. And next, liver cells are clogged with fat. There will be droplets of fat inside the liver cells. That is why the fatty liver is coming. Then next stage, actually this fat is actually giving big droplets, and then it will damage the cell. And the hepatitis, non-alcoholic hepatitis, it's a common condition with the diabetic patients. So all these diseases are actually, this is all coming under the lifestyle diseases, and it is all connected. It comes one after another, one after another. That is the pattern of all these lifestyle diseases. When we take diabetic medicine, we know it is actually increasing the insulin production, and when the body is trying to produce pushing the pancreas to produce more insulin, or if the pancreas is not producing more insulin, you inject insulin. What will happen when you inject insulin? Insulin is promote the liver cells to make make this glucose to fat. So again, it is actually straining the liver cells, and the liver doesn't know what to do with it. And finally, liver will get damaged. That is why when you are taking a diabetic medicine also, you are actually stressing the liver. How? One is it is pushing the more insulin is coming and pushing the pancreas to do more work, and also you are actually, this medicine itself is coming first. When you take a medicine, it is coming first into the liver, and it is actually, the liver has to metabolize it. 80 to 90%, most of the medicines, at least 70 to 80% is metabolized by the liver, and the excess only is come to the circulation. So whenever you take a medicine, it is actually a burden for the liver. A diabetic person, there is already a burden of excess calorie intake by the patient. Actually, this is all unwanted eating and unwanted medicine actually. So when you say lifestyle disease, it is a problem is actually excess food, but you are trying to make it taking more excess food and taking more medicine. That is the way what we are doing now. That is the problem actually. That is the current day problem. 90% of our health issues and is for actually healthcare system is working around this lifestyle disease, and 90% of the medications and surgeries can be avoided provided the people is getting aware of it and try to control their eating habits and do the basic exercise, some exercise pattern also. Then we can solve almost all the problems actually.
See, you are always saying focused on clinically supported lifestyle correction for these lifestyle disorders like dyslipidemia and diabetes and all that. So you always say that 90% of the medication, 90% of the surgery is done because the root cause is lying in lifestyle disorders. So that these lifestyle disorders, according to your vision, it is basically like, it is not because of a lack of medicine or surgery that these things happen, but because of the lifestyle corrections that should have been done but have not been done. So in the case of this a patient with dyslipidemia, that is high cholesterol, high triglyceride and blood sugar all together, what is the approach that you would suggest to such a patient?
See, basically this clinically supported lifestyle correction is needed only for those who are taking so many medicines and all. If a patient is more sensitive, actually, I'm trying to make the awareness to make the people understand it at the earliest stage. If when you are increasing your weight 5 to or 6 kg itself, you are understanding it, or you are pre-diabetic, you are understanding it, and then you can correct your lifestyle by yourself and do some exercise and control your food, and that way you should come and take it, correct it. So you should not go. That is the you should not become a lifestyle disease patient. But if you are already a lifestyle disease patient, you are taking your 3-4 aspirin, clopidogrel, and 3-4 medicines for BP, hypertension, and diabetic, and taking medicine, then you won't be able to manage by yourself. And such patients need lifestyle clinical support. Clinical support means what I'm actually giving this. I'm telling these things from my experience. Those patients, I'm getting many patients like those who are advised to TMT positive. They are already diabetic for 10 or 15 or 20 or 30 years, taking back hypertension medicines for 20 or what, how many are years actually. This depends on the patient's age going up. They will be taking more years of medications. And they might be had already one stent also. And again they had a chest pain and did a TMG or directly gone for an angiogram. And they have found some blocks are there, but no stenting is possible because some of the blood vessels will be calcified. In such situation, there cannot be stent application is not possible, or some special junctions and all. There also stent is not applicable. So they have asked a bypass. In such patients, or even I have seen patients who have already undergone bypass and many stent also, and now also, but their problem is still persisting, and they are not able to walk for a short distance or not able to take bath by themselves. With that bath itself, they get shoulder pain or chest pain or jaws pain and things like that. So in such patients, actually, if it is a type 2 diabetes, before we start the treatment, we do a detailed analysis what is the pancreas function, whether it is a type 1 diabetes or type 2 diabetes, and what is not only the sugar level, is the HbA1c level, insulin level, C-peptide level if the patient is on insulin. Because if the patient is on insulin, the insulin level checking is, we cannot diagnose with whether it is type 1 diabetes or type 2 diabetes. Type 1 diabetes to be handled in a separate way. Type 2, we get 90% is those who are taking even insulin is for the type 2 diabetes. Type 2 diabetes, there is no need for insulin. If the patient is taking for 10 years or 15 years or 20 years or 30 years for the insulin and diabetic medicine, before the clinically supported lifestyle correction, we stop the diabetic medicines. And after stopping, they are not simply sitting, and actually it is not, even the patient does not even admission or hospitalization or anything, they will be checking their blood sugar at home. And after we can, when we start actually for the clinically supported lifestyle correction, it's a low calorie diet actually, and also special exercise to burn, to give all the cells the correct sort of stimulation. Actually, when the cells are stimulated, only the blood will flow to that cell or that organ. So all the organs and all the cells are getting stimulated in a systematic way. That is actually the part of this clinically supported, and making the patient know how to do that, and also support with the nutrients which is low calorie but having all the nutrition. There are 14 vitamins, 14 minerals, and 20 amino acids are out of that around 11 amino acids are essential or semi-essential, and also 4 fatty acids out of that omega 3 and 6 and 9 is essential, and 9 is needed for the body building. So the reduction is made only in saturated fat and the carbohydrates. Most of the patients, if the patient is overweight or normal weight, or if it's a patient is diabetic and all. But after this virtual is, you can check it at home itself, and the BP you can check at home itself. And the virtual, you can see it comes down. If you take the breakfast with this low calorie diet, you can see the virtual is coming down after stopping all the diabetic medicine. After 2 hours, you can see the result. And again, after 2 or 3 hours, 4 times you are checking. By the evening itself, you can see how fast it is reducing actually. And within 2-3 days itself, some patients within next day itself, they see when you record the BP also at 4 times. So we can, if the patient is hypertensive, 4 times BP recording, you can see the BP is coming down. And you should reduce the BP medicine also. Otherwise, the BP may go for a normal person eating all its BP medicines, the hypertension will come, and patient may have a giddiness syndrome. So if the BP is going down, that you have to reduce gradually. The medicines can be better. And the 8th day, if the cholesterol and triglyceride concerned, after starting, the patient will be visiting on the 8th day, and we will be checking the cholesterol and all. And if the cholesterol and the triglyceride will come down, if the patient is following the pattern, see, the nature has, you can't blame. Okay, so there is a pattern for the nature for everything, or in our human is made in such a way that there is a pattern. So if you go with the pattern, go with the nature, or go our natural mechanism, there will be the result will be there. And if the patient is saying that there is no sugar control, then we have to check what they are eating. So we have to advise them what extra food they have taken, and that is the problem. And if the cholesterol and triglyceride, cholesterol will come down, but the triglyceride definitely will be usually reaching around the normal, touching the normal. And we can reduce the triglyceride, cholesterol and triglyceride medicines. And even we will be checking with the carb patient. We can cannot stop this aspirin, clopidogrel, and so many blood vessel dilating. Actually, dilators will be there. This isosapide, nitrate, and so many cardiac. Actually, all these cardiac problem medicines are heart disease medicines are acting on dilating the blood vessels. So dilating the blood vessels make the workload of the heart less, or reducing the pumping, reducing the heart rate actually. This beta blockers, alpha blockers, and so many medicines will be there. This all can be reduced according to the BP when it is reduced, and also the cardiac markers like troponin. Some patients, if I have the heart attack, the troponin may be high, and even this plaque test, and also this HSCRP, CRP, and that is all inflammatory markers for the heart. Those things we have reduced. Then according to that, we can reduce the medicines. And most of the patients, if the patient is following the regime, the medicines can be stopped. Most of the medicines related to this heart and BP and all medicines can be stopped within a month. That is my experience actually. That is actually everything is recorded by the patient, and also the every parameters are measured in the every week itself initially, then bi-weekly, and then monthly. And so everything is settled in monthly checkup. Is blood sugar and all, and BP to be checked at home every day. But the other things we can usually every some cases every week some tests are conducted. But we can reduce when this intensity is low and the blood sugar is recovered. Accordingly, we can reduce the number of testing used.
See, when this with patients with high triglyceride and high cholesterol, uh, normally it is said that such patients also have problems with kidney functioning. So, what is the connection between this cholesterol and triglyceride and the kidney?
See, cholesterol and triglyceride we are taking, we try to reduce because it may form atheromas and atherosclerosis. That is, atherosclerosis means it will deposit inside your blood vessel, and the blood vessel is narrowed, and that is the reason for this heart attack, and we are putting the stent or bypass surgery or is happening for that. So blood vessels are not only inside the coronary arteries or inside the heart only. It is actually these blood vessels are going to the kidney also. If the blood vessels are going supplying the kidney, if it is having atheromas or blocks are there, it is actually damaging the kidney and also the increase the blood pressure also. Actually, one of the reasons for the blood pressure increase is because of this atherosclerosis inside the kidney blood vessels. And also this cholesterol and triglyceride patients is now most of them will be having diabetes also. So diabetes and hypertension and also this high triglyceride, this all actually work side by side to make the kidney damaged. So when we check the actually the most sensitive, generally sensitive test for the kidney damage is one is GFR. That is a calculation from the creatinine actually. And usually when the patient is understanding kidney is damaged only when the creatinine is going high 3 and 4 and the patient is advised to have dialysis. Actually, when the GFR is coming less than 90, itself, when it is coming to 80 and 70 and all, if you are sensitive and if you are willing to correct the lifestyle, you can totally prevent the kidney damage. If you look into the dialysis unit, the patient they are coming actually 90% or 80% will be diabetic patients, or they will be having hypertension. And these things, if you are initially corrected, the patient will not go for a kidney failure and dialysis. Actually, we are trying to correct the diabetes and hypertension and all with the medicines. When you are adding medicines, when you are already your kidney and the liver is sick, when you are diabetic or hypertensive. When you are adding medicine, it is actually increasing the workload of the kidney and the liver and also kidney. Both are excretory organs. If one is getting sick, the other get more workload. And even the skin, you can check when your kidney is damaged or the liver is damaged, your skin get darkened, and also you may get skin lesions. Why? Because the kidney is also an excretory organ. The sweat is trying to give out, take away these toxins. So when the kidney is damaged, the liver is damaged, where the toxins will be diverted to the skin. That is the reason why many patients, if a patient is having a skin disease, especially diabetic patient and hypertensive patient having darkness or coming on the face, they should definitely check the liver condition and the kidney condition. When you are looking for the kidney condition, look for the GFR. If the GFR is coming down, then if it is early stage, you can prevent it going for a renal failure. And also another thing we can look into is urine albumin, urine protein. The protein leak will be there. This is mainly for the diabetic patient and also this hypertensive patient. All this, any diabetic and hypertensive patient who is having a renal problem, there will be definitely triglyceride and cholesterol will be high also. So that all is playing together actually. to make the kidney sick and going for the kidney failure.
Normally, when we talk about this high cholesterol, high triglyceride, the patient generally feels that if he has to correct his lifestyle, it will take time, and at the same time, he feels that if he takes medicine, immediately the results will come. What is your experience of how the patients decide whether they should take medicines lifelong or whether they can do their lifestyle corrections and stop medicines? And how quickly is it possible for a patient who is willing?
If the patient is willing for a lifestyle, that is the first choice. It is the choice for the patient, whether they are willing for a lifestyle correction or whether they are not willing. There are some people who are not. They want to eat every day rice and chapatis and all. They cannot avoid. But if a patient is diabetic or hypertensive or they are obese and all, they should have some willingness for the control. Actually, even non-veg items, many people are very worried about avoiding non-veg. Actually, it is not a must. You have to avoid the non-veg also. But the calorie content, the fat and the carbohydrate, you have to control. You can take, if you are not in a renal failure or your kidney is not much affected, we restrict the non-veg items to avoid, we advise for this clinically supported lifestyle correction, avoiding this non-veg items only if the renal function is gone below 60. Actually, you third level of renal failure. For only that patients, it is non-veg reduction is avoiding. You can not take it too much, but you can have. But the carbohydrate, rice and wheat, you have to rice and wheats and even the millets you have to reduce. If till the sugar is controlled, you have to reduce the. You have to cut this millets and this generally speaking cereals. But you can usually the sugar control will be if you are properly within 2-3 days your sugar will be controlled. Next, this calorie control is this carbohydrate is cutting to reduce your excess fat actually. Your fat has to be burned out and to be used. You cannot burn out or you cannot expel it just like urine. You cannot remove the fat once it is got into your system. You have to oxidize it to make it into carbon dioxide. That is the only way out. So for that, if you're taking carbohydrate and some oil and nuts and all, if you're taking, then that will be used for your energy. So your fat is stored fat will be there. So what we are trying with this clinically supported lifestyle correction is to reduce your fat by using that. So it is very fast actually the result. The blood sugar going down, you can see it within few hours itself. And also this cholesterol and triglyceride, you can see within a week because we don't we have to go to the lab and do it. So you can easily see the result within a week. Usually we check it within a week, 8th day. We are starting on the first day and we stop all the diabetic medicines on the day first itself. And blood sugar level you can check there and the BP level you can check. And in between you can communicate, you usually use the telemedicine communication for in between time. And the third day itself, most of the patients BP medicine can be start reducing in the third day itself. And how it is going, we can continue and reducing. And on the 8th day, we can check the cholesterol and all. And even the patients with thyroid disease and all, who are taking thyroid hormone and all, Usually on the 8th day we check the thyroid levels and we can start reducing that also. So within this cholesterol medicines and all should not be stopped immediately. As a diabetic medicine we are stopping as a immediately, but the other medicines only gradually. Otherwise, if you are taking 80 milligram cholesterol statin and you are taking on the same stopping, then the cholesterol level will be shooting up. So that should not be done. It will be gradually. And also the psychiatric medicine. Those who are taking psychiatric medicines that also having an addiction tendency, that also will be reduced only slowly. So there is a pattern for different type of medicine. Diabetic medicine one way, antihypertensive medicine another way, and the cardiac medicines for the heart disease in another way. That all are pattern, because we should know that how it can be. It cannot be reduced to some patients as I'm going to stop all the medicine. No, if you are on medicine, you have to stop only gradually and according to the lifestyle correction and according to your body composition correction and according to the blood parameters also. So if the blood parameters are coming down, for the cardiac markers are coming down, we can reduce accordingly. So it is very fast. That's the general. This thing is the patient is correctly following the advice correctly. Most of the medicines can be stopped within a month. The patient will be free of medicines within a month. That is the routine pattern. Only thing they are put the patient already cardiac stent or something, put on stent within 3 months or something. They cannot stop this blood thinness, especially the clopidogrel and this ecosprin and things. You have to stop, or you may have to take it up to 1 year, because that stent has to be covered with your own cells actually. Otherwise, that is a foreign body. That's the blood clots can form on that, and it can lead to a stroke or heart attack or something like that. So you should be very careful if you are put on a stent. You should be very diligently in time. You have to take the this blood thinness. Otherwise, if you are not put on the patient comes without putting a stent, it is easy, so that he can be relieved of all the medicines. But unfortunately, some patients will be only getting awareness about this after putting a stent.
Actually, in this dyslipidemia case, high cholesterol, high triglyceride situation, the patients may have been on medicines for this cholesterol and maybe for triglyceride for a long time. So normally when they have to, even in spite of this continuous medication, we see that if they ever stop the medicines, immediately their triglyceride and cholesterol will shoot up. So actually, do the patients really understand what the medicine is doing, or are they thinking that their cholesterol and triglyceride problem does not exist when the medicines are being taken?
About in 1900s, actually 60% of the death was due to infections, actually, communicable disease. Now, even in India, actually in the latest studies and the reports are showing that 62% of the death is due to lifestyle diseases. Lifestyle disease, totally because of the lifestyle diseases. The other, around 38%, and is around 20 to 25 is because of the infections and neonatal death and things like that. And the rest, around 10 to 12%, is because of the injuries. With the COVID, we know that even this death due to infection, the COVID virus, happens only mainly because of the happened mainly for these lifestyle diseases like diabetes and hypertension patients. So in effect, almost 80 to 90% of the death finally comes to because of the lifestyle diseases. Even we can see that injuries is also happening because of this lifestyle, higher in the patients with the lifestyle diseases. This alcohol use, RTS and all. Because of mainly these patients, because of their health, these accidents also is happening, or because of the drug abuse, the accident is happening. So in effect, most of the death is because of the currently the disease, and we are actually able to extend the lifespan of the person. That is because of the antibiotics and the hygiene mechanisms, and because of the prevention of the or treatment of the infections. We are able to deal with the microbes actually. But now the problem is these lifestyle diseases. Lifestyle diseases because of our change in the lifestyle pattern, sedentary life, and we are not adjusting because we don't need much calorie, but we are eating more because it is more tasty food is available without any effort actually. So the food is more, the taste is added taste, and so we are getting addicted to this tasty food with this added colors and preservatives and tastemakers. So that is the reason for the current disease. The diabetic is actually only because of the excessive calorie intake and sedentary lifestyle. So when we look into the broader pattern of the disease pattern currently happening, is either it is infection or a metabolic disorder, that is diabetes, hypertension and all is coming under that, or an allergic disorder, asthma, skin problems and all, or an autoimmune disease, that is our immune system is overreacting. In allergy also, our immune system is overreacting, and also in autoimmune system, our immune system is overreacting, and cancer. All these categories coming under the inflammatory disorders. Inflammation, lifestyle disorders are all coming under inflammatory disorder, and even this viral infections and microbial infections also is actually inflammation. So, if you want to control the lifestyle diseases, you need to correct the lifestyle disease. What is the abnormality in your lifestyle? It cannot, these lifestyle diseases like diabetes or hypertension or heart attack or stroke or cancer, it is not because of the lack of medication, not because of lack of surgery. The cancer is coming not because of lack of chemotherapy medicines, that highly toxic medicines you are injecting or taking. It is because of the lifestyle that the toxin is accumulated in your body and it made a genetic damage in your body. And this genetic damage is making the cells overgrow, and the control of the cell division is gone, and your cells are multiplying and growing as a tumor, and then it is getting loosened from the tissue itself and getting implanted in the liver and brain and all, and start growing there. So that is because of the toxins and the accumulated toxic effect and the genetic damage. Actually, when we look into all the diseases, there is the genetic damage also coming out. Genetic changes coming into the somatic cells. If it is a genetic damage coming into the germ cells, you will get the baby is diseased, baby get damages and congenital abnormality will come. But if it is the damage is coming into your regular somatic cells, if the damage is coming in the liver cells, liver cancer can come. If the damage is the accumulated fat in the blood vessels, you get a block, and if it is in the heart, you get a heart attack, or if it is in the brain, you get a stroke. That is the difference. So the easiest way to deal with this problem is to do the correction in your lifestyle. It is not the medicines can be used. Definitely, medicine has a very good value, especially the antibiotics is life-saving. And also, if it is when you are getting a poison, the snake bite, or even you are getting an allergy, the steroid medicine is life-saving, and even the anti-venom medications and all life-saving. Definitely, all is needed, and even the advancement in the surgical care is very beneficial for this accidents. So if you are getting an injury, that is the only way. That is the medication and surgery is actually life-saving, but not for the lifestyle diseases. When you are having a lifestyle diseases, try to correct it initially itself. Then you don't need, you can correct by yourself. But you have progressed, and then immediately for the control of the blood sugar or BP and all, you may need medication. But after when you get the control with the medication, or you get a heart attack, definitely you know need medical help and the medication is needed. But when you are stabilized, but you don't need to put a stent or go for a bypass. When you are stabilized, then you can try for the lifestyle correction, and then you can gradually come out of the medication. Not to suddenly just to stop. Medicines are not good, and I won't take medicine. That attitude is not good. You should be you should be healthy and you should be symptom free, and you should be your body parameters to be controlled and to be taken to normal situation. Then when you are only on a stable body and can do this lifestyle correction and all. Lifestyle correction means you have to control your food, but you should ensure that all the nutrients are in the correct format, and you are reducing your toxins you are getting inside your body. That is, and also you are giving increase your blood is flowing to all the cells. To increase the blood flow and to remove the toxins, you have to do the basic exercise also. That is the basic principle of this clinical support to lifestyle correction also. And the result also, and you should not be blind on anything. You should see the result by testing also. You can check the blood type. In India, it is the one craze, and you can do the blood test, and the tests are also and compared to Western countries and other countries, they are less expensive also. So you can check the blood and see the result also. And you don't believe anyone who is saying that, oh, this will correct you. Don't believe it. You check it by yourself and see the changes happening inside your body. And you say that that's the easiest way is the blood test. And also, if it is a scanning and size of a tumor or fatty liver, or you can do the ultrasound scan, that is the least expensive, and also no side effects also. But other scans like a CT scan and MRI and PET scan and all, it should be used with caution because that have its own side effects also. So simple blood test and also this ultrasound scan you can use for checking your progress also.
Actually, in the case of this dyslipidemia of cholesterol and high triglycerides and all, what is the time frame that a person with high high levels should understand that he will need to reach desired levels?
So I can tell you an example of one person. He was in actually, one patient actually has come to me. This past. Okay, actually he is actually diagnosed with dyslipidemia. Actually, when he checked initially, his triglyceride level was 1500 or something like that. It was so high, and he was actually undergone a medical checkup in Dubai or some Gulf countries. And he, because his triglyceride and all is very high, he suffered and he came down to Kerala. Immediately he has gone to one multi-specialty, one major hospital here. They have checked, they have done all the checkup and all, and he is he has asked to go for angio. I don't remember exactly. He has gone for angiogram, already done, and I think he has done an angiogram also. He has very block is there. He has advised to have a bypass, and they have started with 2 or 3 medicines for the this dyslipidemia. But when he come to me, he has then he saw about this lifestyle correction, and he wanted to see what is the possibility. He was advised for a bypass, I think, and his cholesterol triglyceride had come down, but the cholesterol was around 250 and the triglyceride was around 350 when he came to me. Then he was starting with the clinically supported lifestyle correction. By the 8th day, his triglyceride level has come down to below 200, and this cholesterol also, I think, is well down. And within 15 days, actually, he was completely all the medication. He was diabetic also. He was diabetic, hypertensive, and this dyslipidemia is there, and advised to have a bypass. Within 2 weeks, almost all the medicines were over, and by the 3rd week or so, the whole medicines was over, and his with the medicines, his blood sugar and exactly values and all, I don't remember. But even with the insulin, he was on insulin and diabetic medicine also, his values were much higher. But within a week, diabetes is completely, blood sugar was normalized, and BP was normalized within 2 weeks, and the cholesterol and triglycerides were normalized within 2 weeks, and the tapered of the medications, I don't remember exactly 3 weeks or 1 month anyway, he was without any medicines, and he stopped all the medicines, and all the parameters was normal and gone back to his workplace. That is the result actually. Only through the patient, and most probably within 1 month, you will be able to reduce your weight also 10%. If you are 80 kg, you will be down to 72 kg, or when some patients even little more also. In a 1 month, that is also possible, and it's all by everything is coming. You are in this lifestyle correction. All the system is getting corrected. Your blood sugar will get corrected. Parallelly, your cholesterol will get corrected. Your triglyceride will get corrected, and the blood BP will be corrected. That is the most common parameters, no? And many of the patients will be having this uric acid also. Most of them will be taking medicine for the uric acid also. That also can be stopped and reduced. And most of these patients will be started with blood thinners also. So, because cardiac patient, blood thinners. If they are not put on a stent already, you can reduce the blood thinners also, because the cardiac parameters, troponin level will come down, HSCRP will come down. When the HSCRP and troponin is come down, you can start reducing the blood thinners also. Because blood thinners also is not good for any person. Because a person with a heart hypertension, blood thinners can give a stroke. Because the brain hemorrhage, because brain blood vessels are very narrow, and this is because we are all worrying about the stroke. Hypertensive patients, bigger worry is a heart attack, or even bigger worry is the stroke. And a person with hypertension who is on aspirin or propidogrel thinness, then if a small bleed occurs in the brain, it can become a higher major bleed, and that is the problem. So it is not at all safe to take hypertension medicine and the blood thinners together, because there is already hypertension is there, And along with it, what we are seeing is taking medicine for the hypertension, and along with it, this aspirin and copper medication. So that we also know that one famous personality was taking aspirin got a subdural hematoma in the brain and having surgery and all. So that is, we should be all the people who are taking aspirin and copper, these blood thinners should be very careful about the bleeding also. That brain bleed is the most dangerous thing. So hypertension, definitely that the chance of brain bleed will be higher a person who is taking hypertensive medicine, and also this blood thinners also.
I think that sum up today's discussion, and thank you.